Well, I'm Dr. Wayne Hollar. I practice in Lenoir, North Carolina, and I have been a loop-mounted camera user for a long time, starting in 2007. The advantages that you get from using the camera and being able to show patients what you see, there's just not any other way to do that. Hygiene also, when I do hygiene checks with pediatric patients, come into the room, pediatric patients are sometimes, they're sometimes hesitant. They're sometimes, they don't know what to expect. And we use the camera when we're doing the exam to show the kids their mouth.
I tell them, have you ever been on TV? And they said, oh, no. And I said, well, you're going to be on TV today. Then when Dr. Hollar comes in, I tell him, I said, we're going to go now to tooth TV. And then we switch over, and it's their mouth that they're seeing. And it's real cute because a lot of the first-timers, they'll stick their tongue out.
Watch this, and I'll put the camera there and say, hey, who do you see there? What is that? And they'll always grin and start wiggling their tongue and things like that. So they realize that we're just looking in their mouth with the camera.
He gets more cooperation from young children because they're actually looking at their own mouth.
But there again, as I'm looking and pointing out things, the child can see that. But more importantly, mom or dad or grandma, grandpa, whoever's with them, that's in the room with them, can also see on the computer screen what we see.
They're just much more cooperative and calm about the whole situation. So it really comes in handy for the young kids.
So then, again, just like the patient that we do the exam on, this time mom or dad, as we're describing and documenting and logging what we see and talking about it between ourselves, me and the hygienist.
What I do with the kids is I'll polish half of the maxillary, and then they've got those two front teeth. One is the one that's clean, and the other is the one that's covered with plaque. And that would give the parents an indication that they aren't with their children of what they need to help that child with it.
The parent can also see that. They can see that decay on little Johnny's tooth, or they can see that, the fracture, or they can see, let's say if maybe they've got bad hygiene and there's lots of plaque or whatever. They can see that now. So that's another way with hygiene. I mean, the possibilities there's a lot of possibilities.
If you see a solid pink mouth, you kind of don't know what you're looking at. But if you see half and half, you know how much plaque there was on the teeth, because you're seeing the before and after. So I think it would be a real asset.